Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 8:20 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 PM on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today, we're thrilled to be joined by Dr. Arturo Saavedra, a physician leader and scientist who serves as Dean of the VCU School of Medicine. He joins us for what we expect will be a fascinating conversation about his path to medicine after dreaming of an aerospace career as a youngster in Puerto Rico, his professional stops and days competing as a triathlete, the work of training future clinicians amid ongoing healthcare workforce shortages, and more. So with that, welcome to the podcast, Dean Saavedra. Thanks for being with us.
Thank you for having me, Mr. Walker. I really look forward to this conversation.
Likewise. So let's just jump right into that conversation. For the benefit of listeners, we like to launch these conversations by getting a deeper sense of who our guests are. What we know about your background, Dean, is that despite having physicians as parents, your initial interest was aerospace rather than medicine. You're credited with developing a computer program related to space shuttle landings that attracted interest from NASA, which indirectly landed you an invitation to the 1990 Nobel Prize ceremony, where you met a transplant surgeon, which shifted your focus to medicine. After graduating high school early, you attended Harvard University for undergrad studies, and then medical school and doctoral training in pharmacology at another Ivy, the University of Pennsylvania in Philadelphia. From there, you completed residency and fellowships in internal medicine and dermatology. You also managed to earn an MBA along the way, and after working in Boston, you came to the University of Virginia to chair the dermatology department and lead population health efforts there. You joined the VCU School of Medicine last year, and in addition to your scholarly research and clinical accomplishment, you also once competed as a triathlete before injuries derailed you. I'm sure that high-level summary only scratches the surface of your unique personal story, so if you would, please fill in the blanks and tell us more about the essential you.
Well, thank you for that summary, Mr. Walker. I hope my mom is listening to this recording. As it turns out, I think I was always motivated by value to others. How does one really serve? We live in a world where things change very quickly, and problem solving to the greater community benefit is very important. So whether you do that by trying to land space shuttles and understanding how large things can possibly fail, or whether it is in a clinic visit to diagnose a cold, or maybe something more serious like cancer, it is service to others and problem solving that really motivates me. As it turns out, one thing that space shuttles maybe share with healthcare is that these two agencies are large, they're complex, they're expensive, but if not really thought about carefully or orchestrated, they can in fact fail. So whether you call it a computer glitch and a missed landing, or whether you call a laboratory value that wasn't reported at the right time, or a team that doesn't work seamlessly together and can result in less than optimal patient outcomes, it is those examples that really motivate me to think about how we do better. Always better.
Absolutely. The scientific process and method needs to be followed closely and rigorously to achieve those optimal outcomes. VCU Medical Center is a busy academic medical center and teaching hospital situated in the heart of Richmond that serves a diverse population, providing a wide range of clinical services, including a level 1 trauma center. Also on the bustling campus is the VCU School of Medicine, which is a training ground for many future physicians. From what I gather, Dean, your vision incorporates several guiding philosophies, among them leading on population health and health equity, promoting continued innovation at a top 50 research institution where many clinicians and scientists are working on cutting-edge, grant-funded projects to develop the treatments of tomorrow, enhancing patient access and engagement in the care process, and inspiring community engagement among students. As an institution, VCU is known for investing in underserved communities. Given that foundation, I wonder, what are some of the key strategies you're pursuing to advance the mission to position the School of Medicine for continued growth and impact?
Thank you for that question. I think when we think of population health, we really think of communities defined geographically, but we also think of communities defined by common diseases or states of health. In population health, we look at everything that impacts the care of patients, whether that is the ability to secure food, to pay for rent, or really the ability to understand medical language. My motivation is really to be out there to help populations understand not only that we want to see them, that we welcome them here, no matter who you are or where you come from, but also that we're here to patiently go through your medical journey with you. We understand that doctors speak lingo, and we want to make that accessible to all patients. A second motivator is that of being really the guardian of our profession. I was once a student, and now I am a teacher. I can't wait for the time that my students will become teachers and not only teach content and interest in this field, but really to teach passion, how privileged it is to be able to take care of others. You know, it is often said that only about 20% of medical care comes from treatments or medications or procedures. The remaining 80% come from what we call the social determinants of health, where you live, where you were raised, your personal beliefs, your transportation means, what food you eat. And if we don't really understand all of these aspects about our patients, and more importantly, if we don't teach others to understand how to elicit that information, then we really aren't thinking about the greater portion of medical care. So what is a motivator? Teaching kindness, teaching inquisition of knowledge, but more importantly, to be thorough in history taking so that it isn't just about the physical exam. It is also about the history and the reality that patients find themselves in.
Well, I love that perspective, and I appreciate you sharing it. Just recently, we had Dr. Paula Ferrata, formerly of VCU, now at Inova, as a guest on the podcast. She is originally from Colombia, and she talked about, and you use this word as well, the privilege of practicing medicine. She talked about that and how her goal was to practice medicine in the U.S. We talked a few moments ago that your goals initially were different, and they transitioned from perhaps science and aerospace into clinical science and the delivery of care. I'm curious, when you talk about things like social determinants of health, population health, and those factors that really get at individuals' health outcome, some of which are not in their control based on their zip code or where they live. I wonder how your own background, coming from a U.S. territory, may influence your perspective on those kinds of ideas.
Thank you so much for that question. And I want to say that sometimes we answer these questions in the theoretical, but I have a very, very practical scenario for you. I was raised in a small town in an island where we did not have all the medical services we often needed. And my own mother, herself a doctor, had headaches most of her life. She saw neurologists who thought she had multiple sclerosis, and I can remember many times her visiting the emergency room for various medications. It wasn't until she came to the States on a visit that her headaches recurred. And when she presented to the emergency room here, a fellow in the emergency room just looked at her MRI and noted that she didn't have multiple sclerosis. In fact, she had a very, very rare tumor that was very little known. Now, her doctors treated her compassionately. They understood that maybe she hadn't had as much close follow-up, and even herself being a doctor, she couldn't understand exactly this new diagnosis. This doctor was thoughtful, patient, really reviewed all the information, and when no one else could offer anything better, he offered her hope. She had a very complicated surgery, and 22 hours later, my mother was back, able to drive and able to read. So what is my motivator? Not just this theoretical interest in making healthcare more accessible, but in many ways it is a way of saying thanks to many of those that have treated my own family and that have been mentors in ways I could not otherwise have explained. So it is really curious that in medicine we can become mentors to those we may never even meet. Our ability to be thoughtful and kind and the way we comport ourselves with patients is probably the most important thing we teach.
And that's such a critical idea because oftentimes the patient population, you just shared a story about your mother who has clinical training, but still had a condition that was not properly diagnosed until further investigation. And so your mother was armed with more knowledge than the average person about clinical matters. But for many patients that are interacting with healthcare providers, they just don't have that knowledge base. And so I think it's such a critical point that you made there, this idea of treating patients with kindness and meeting them where they are and giving them that level of understanding so that they can have the comfort, to use your word, to just reassure them in a moment when they might be feeling vulnerable or uneasy because of a medical diagnosis, either an uncertain outcome or just something that is naturally frightening. So really, really love to hear that from you. We're recording with Dean Saavedra in mid-August. Earlier this month, first-year medical students put on their white coats for the first time as part of an annual ceremony welcoming future physicians. We speak with many physicians on this program, and I have some friends who are doctors, and the general sentiment we hear is that medical school is very rewarding, but also quite challenging. My question is about your views on effective workforce development strategies for the future. It's something we're actively working on here from a policy perspective at the association, and this work is occurring at a time, as you know, sir, when the retiring baby boomer generation is creating something of a bottleneck of healthcare demand and utilization. And there are also current staffing shortages across healthcare roles, including doctors, nurses, psychiatrists, and more. And there are future shortages projected. And obviously, being in a post-pandemic climate has also had some impact on the overall workforce in healthcare. This is something of a loaded question, but as someone who's directly involved in training future physicians, I wonder what some of your prescriptions are for addressing some of these workforce challenges, both near term and on the horizon.
This is probably one of the most important things to think about currently in healthcare. If you think about it, as more knowledge is acquired and we learn more from our research scientists and population health scientists and really researchers everywhere in the world, we have found ourselves in this incredible situation where we can just no longer teach content. We are now forced to teach something else. We have to teach context. In very quick 4 years, we teach medical students the general basics of disease, but we also now have to teach them new skill sets that are becoming even more important. For example, how does one review the large databases of information and pull up from that database what's really relevant, what's substantiated by data? Where should we be looking for the information? Number 2, we have to really train people in working in large teams. Medicine is no longer something any one person can do. It's a team sport. So how do we really teach them to communicate with other members of the team to make sure that the responsibility lies on a group of people and not in one person? Number 3, how do we think of technology without fearing it? For example, artificial intelligence, how does that help us navigate these complex environments without even considering that they may replace the human thought or touch? I think as we teach context, team spirit, the use of technology, and our new ways of interacting with patients, we will get to the right place when patients come first.
Well, that is the name of this podcast, Patients Come First. So I love that connection right there. Dean Saavedra, we've looked forward. Now I'd like to look a bit backwards. From what I've been told, during the AIDS crisis, you worked in the same lab as former CDC Director Dr. Rochelle Walensky and Dr. Anthony Fauci, who anybody paying attention knows from the national COVID response. He's the former director of the National Institute of Allergy and Infectious Disease. I have to imagine that was a unique experience. I'm curious to know what lessons from that period of time continue to inform your career and your approach today.
Thank you for that question. Yes, I did have the opportunity to work in the same environments as those two very notable individuals. And what I tell you, frankly, I learned how much of a pleasure and a privilege is to be part of large thinking. Hard things are hard, and we need to really commit to the big problems. I think as part of our moral imperative, when we have the privileges we have to be able to pursue an education in medicine, to be able to refine that knowledge in residencies and fellowships, we have to also commit to tackling the tough problems, whether we solve them initially or not, whether we fail a couple of times, whether we don't get the grants we want or publish in the journals that we want. I think it is through incremental change, it is through collaboration that we really attack the big problems. Going back, for example, to infectious disease, it wasn't very long ago when I was a medical student. And at that time, regrettably, we had very little to offer patients with HIV disease. They showed progression, developed skin lesions that we call Kaposi sarcoma, often presenting to the dermatologist as a changing mole, only to hear that, in fact, they had Kaposi sarcoma and therefore HIV at a time when we could do very little. Often people demise to terrible infections, sometimes to bleeding from the gut and the lungs. And it was really a frightening view. How could we be limited by lack of knowledge? And fast forward to today, where we have medication that not only suppresses the virus, but allow people to live a normal life, to have children, to share intimately with others who may not be infected. And these incredible strides in knowledge are not accidental. They are absolutely a commitment across groups of scientists and public health workers and students who are motivated by one thing. Again, progress and patients come first. There is no excuse for a stone left unturned. If it's a big problem, we commit to solving it.
Well, I want to commend you for all the work that you're doing at the VCU School of Medicine, and I know that I can speak for others out there in the healthcare community that we have high hopes and great anticipation for that progress that continues to come, sometimes tough, sometimes challenging, sometimes slowly, sometimes rapidly. But I know that you're leading the charge in your role as Dean of the School of Medicine, so really appreciate that. We are going to land this plane here momentarily, but before we do, we're going to follow our tradition on this podcast where we close by asking our guests a pair of fun and slightly surprising or quirky questions. To keep things interesting, we have a list of 10 mystery questions. And so if you would select two numbers between 1 and 10, I will give you the corresponding questions.
3 and 7.
Okay, 3. 3 is, what is the best piece of advice you've ever received, and why does it stick with you?
Best piece of advice. Be motivated by what you want to have happen, not to avoid what you don't want to have happen.
And why does that stick with you, or how does that apply to your life?
It applies to my life because one should never be deterred by fear. Fear is a common human experience, and if we succumb to it, we don't show progress. You pursue what you really want to see be the outcome, in spite of those obstacles that may get in our way, either externally or internally.
Give it your best and then live with the outcome. That is great
advice.
That's right. And then number 7 you selected, if you could choose one superpower to have, or any one skill to instantly master, what would it be and why?
I would love the skill to be able to understand people's emotional state. Sometimes we are not able to put into words how we're really feeling, and that can impact conversation and communication. But if I had a superpower to really be able to identify someone's emotional state and be able to decode that towards the right end, I'd be really, really happy, doctor.
Understandable. I think in comic book world, they call that an empath. So
That's right. That's right.
Well, listen, I appreciate you spending a few minutes with us out of your busy schedule, sir. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. And we want to once again thank our guest, Dean Arturo Saavedra, for joining us today. So thank you, sir.
Thank you for having me, Mr. Walker.